Hi friends. In this session we will be doing prioritization, delegation and assignment question. Question number 1. The nurse is helping a client with a spinal cord injury to establish a bladder retraining program. Which strategies may stimulate the client to void? Select all that apply. Option A. Stroking the client's inner thigh. Option B. Pulling on the client's pubic hair. Option C. Initiating intermittent straight catheterization. Option D. Pouring warm water over the client's perineum. Option E. Reminding the client to void in a urinal every hour while awake. Correct answer. Option A. Option B. Option D. All of the strategies except straight catheterization may stimulate voiding in clients with a spinal cord injury, SCI. Intermittent bladder catheterization can be used to empty the client's bladder, but it will not stimulate voiding. To use a urinal, the client must have bladder control, which is often absent after SCI. In addition, every hour while awake would be too often and ignore the bladder filling at night. Question number 2. A client with a cervical spinal cord injury has been placed in fixed skeletal traction with a halo fixation device. When caring for this client, the nurse may assign which actions to the LPN/LVN. Select all that apply. A. Checking the client's skin for pressure from the device. B. Assessing the client's neurologic status for changes. C. Observing the halo insertion sites for signs of infection. D. Cleaning the halo insertion sites with hydrogen peroxide. E. Developing the nursing plan of care for the client. F. Administering oral medications as ordered. Correct answer. Option A. Option C. Option D. Option F. Observing for signs of pressure or infection is within the scope of practice of the LPN. The LPN also has the appropriate skills for cleaning the halo insertion sites with hydrogen peroxide. Administering oral drugs is within the scope of practice for an LPN. Neurologic examination and care plan development require additional education and skill appropriate to the professional RN. Focus, assignment, supervision, test-taking tip. The RN must be aware of the scope of practice for an LPN. This may vary from state to state and may depend on whether the LPN has additional education. Generally, in-depth assessment, care plan development, and in-depth client education remain within the scope of practice of the professional RN. Question number 3. Which actions should the nurse delegate to an experienced unlicensed assistive personnel, UAP, when caring for a client with a thrombotic stroke who has residual left-sided weakness? Select all that apply. Option A. Assisting the client to reposition every 2 hours. Option B. Reapplying pneumatic compression boots. Option C. Reminding the client to perform active range of motion (ROM) exercises. Option D. Assessing the extremities for redness and edema. Option E. Setting up meal trays and assisting with feeding. Option F. Using a lift to assist the client up to a bedside chair. Correct answer. Option A. Option B. Option C. Option E. Option F. An experienced UAP would know how to reposition the client, reapply compression boots, and feed a client, and would remind the client to perform activities the client has been taught to perform. UAPs are also trained to use a client lift to get clients into or out of bed. Assessing for redness and swelling, signs of deep vein thrombosis, requires additional education and skill, appropriate to the professional nurse. Encephalitis is admitted to the medical unit with new-onset generalized tonic-clonic seizures. Which nursing activities included in the client's care will be best to assign to an LPN whom the nurse is supervising? Select all that apply. Option A. Observing and documenting the onset and duration of any seizure activity. Option B. Administering phenytoin 200 mg per oral 3 times a day. Option C. Teaching the client about the need for frequent toothbrushing and flossing. Option D. Developing a discharge plan that includes referral to the Epilepsy Foundation. Option E. Assessing for adverse effects caused by new anti-seizure medications. Option F. Turning the client to his or her side to avoid aspiration. Any nursing staff member who is involved in caring for the client should observe for the onset and duration of seizures, although a more detailed assessment of seizure activity should be done by the RN. Administration of medications is included in LPN education and scope of practice. Turning the client on his or her side to avoid aspiration is certainly within the scope of practice for an LPN. Teaching, discharge planning, and assessment for adverse effects of new medications are complex activities that require RN-level education and scope of practice. Question number 5. All of the following nursing care activities are included in the care plan for a 78-year-old man with Parkinson's disease who has been referred to the Home Health Agency. Which activities will the nurse delegate to the unlicensed assistive personnel, UAP? Select all that apply. Option A. Checking for orthostatic changes in pulse and blood pressure. Option B. Assessing for improvement in tremor after levodopa is given. Option C. Reminding the client to allow adequate time for meals. Option D. Monitoring for signs of toxic reactions to anti-Parkinson medications. Option E. Assisting the client with prescribed strengthening exercises. Option F. Adapting the client's preferred activities to his level of function. Correct answer. Option A. Option C. Option E. UAPs can reinforce previous teaching or skills taught by the RN or personnel in other disciplines, such as speech or physical therapists. Evaluating client response to medications and developing and individualizing the plan of care require. Thanks for watching. For more videos, please like, share, and subscribe.